Good morning, everyone, and welcome to the Advocacy webinar. Tony will be taking us through a lot of very exciting things today as soon as I turn things over to him. Hopefully you all have been adequately surviving the polar vortex that we've been having. I know we've had a whole lot of fun here with schools not being in session a whole lot and whatnot of late.
I just need my PowerPoint up. Good morning, everybody. Hope everybody is doing well and that you're keeping warm, whatever you're doing today. Another cold one. Hopefully, the next time we speak, it will be absolutely warm. We'll all be talking about what a beautiful spring day it would be. Wouldn't that be exciting? So, but let's get started. First thing we want to talk about today is March 11th, which would normally be our advocacy webinar, second Tuesday of the month. We're actually going to come together and have the Speak Up for Prevention Advocacy Day. We have had these days in the past. They've become, I think we used to call them Legislative Education Day, and we thought this would be a little prettier name. So what we want to do is go down to the State House on March 11th and speak up for prevention, which is not something that's done all the time or is on a whole lot of legislators' radars. So the way that the day will go, and we encourage you to register at drugfreeactionalliance.org under the events page. Registration will begin at 9 o'clock with the meeting taking place at the Worthington Library on Hard Road in Columbus, Ohio. And what will happen is we will have a short program there and then proceed down to the State House to visit with legislators. Emily can help you make those connections, those appointments, if you need help with that. And kind of going the way that CADCA does, we understand that downtown Columbus, especially with construction sometimes and one-way streets, that we are actually going to, we've rented a bus, and we will be transporting people from the Worthington Library down to the State House, so that can save people who want to take part a little bit of driving, the price, the cost of parking, all of that kind of stuff. We're really, really excited. Our keynote speaker this year is a guy named Vince DeMarco, and Vince is a nationally recognized advocate for public health causes such as alcohol, tobacco, gun violence. He is the subject of a book by nationally advocacy leader Michael Perchuk entitled The DeMarco Factor, Transforming Public Will into Political Power. And Vince's work has resulted in successes such as the landmark 2009 law that authorizes the FDA to regulate tobacco products, an increase in Maryland's cigarette tax, and the first increase in Maryland's alcohol tax in 40 years. He is an adjunct assistant professor at Johns Hopkins Bloomberg School of Public Health, where he's working to educate public health students from around the world on effective methods of advocating for public health policies. So we're really, really excited about him coming to this day, taking part, giving us much of his knowledge, and will also be a good way to see him. He'll also be a keynote speaker for us in April at our Midwest Alcohol Policy Summit. So we're really, really excited to have Vince be part of this day, and hope that you are as well. I think we'll be back somewhere around 3 o'clock, is it? Okay, so we'll be meeting around 2 or 2:30.
and we think it's already on our website, which is even better. So. Okay. Hope everybody can hear me. I made a little switch with my headphones here. To talk about Legislative Advocacy Day, just want to go over some quick points that that will hopefully alleviate any questions. Please dress, business dress, whatever kind of suits or whatever. These folks are used to having, dressed to the nines. I guess your church dress, if you're religiously motivated. But the best, dress to the nines, so that these people can take you seriously, and know that you are serious about what is going on in your community. Also, be prepared to tell your story and who you represent. What is going on in your community? The only way that these folks can, the legislators can know what is going on without media bias and everything else is by you. You are the experts in your community on this subject. They get lobbied an awful lot by lobbyists, by different interest groups, but you're the real experts. You're the one that knows what is going on in your community, and they need to know that. What is the drug of choice in your community? Is it prescription pills? Is it marijuana? What's going on with the youth and the schools in your area? Discuss the importance of prevention, and we're going to provide a one-pager that kind of gives a cost savings of prevention infograph to you, and then also if you could provide a one-pager about your community, what you're doing, some local stats, all of that kind of stuff, and events. Invite them to any event that you might be having, or a meeting, to come speak at a meeting, especially if you're meeting a representative. All representatives are going to be up for election this year in the Ohio House, which means that it is campaign time, which also means that they want to get out there, they want to share their message, they want to share what they want to do for the next 2 years. And this is a great opportunity to invite them to your coalition meeting, to a local event, to let representatives talk about what they see as far as drug and alcohol prevention, treatment, and recovery, how it impacts state budgets and things like that. So these are just some of the talking points that we really encourage you to think about. Again, bring a one-pager about your organization. Don't bring whole batches of stats and all of that kind of stuff. These are people who get probably 8 or 10 subject areas a day that they have to look at. So the quicker and more succinct kind of document that you can give them, the better. An overview is what they need. They don't need to get into the weeds. If they have more questions, this is what this is about. It's developing that relationship and nurturing that so that they can be informed when they make votes and think about issues that affect the state of Ohio, especially drug and alcohol and behavioral health issues. So hopefully that is pretty easy for everybody. You should have those types of things anyway, and just bring them. And we will have a folder for everybody that you can slip your card, you can slip your local piece right in, and can hand over to your legislator. Speaking of the State House, we've got a couple of bills that just wanted to bring up today. The first one is, I'm kind of going in backwards order, is House Bill 392, which is the Good Samaritan law dealing with alcohol. Basically what this bill would do would, if a young person is drinking and has some kind of medical emergency or some kind of issue, and another young person who is drinking underage calls the EMTs or some other kind of health official to help their friend get out of whatever kind of health emergency they might be in, to basically protect the young person's life, then that person will not be prosecuted for underage drinking. Now, this would not include if they are drunk driving, if they are doing something negatively in the community. This would not relieve them of this. It would just basically allow them to make that call without fear of prosecution for underage drinking. Marcy will actually be testifying on this bill tomorrow at 4:30 in the afternoon in front of the House Judiciary Committee. So if you have any kind of comments or anything like that, there's a couple colleges that already have it in their college code now, and this would make it a statewide law that would allow young people to make that call to save a life. Sadly, at Denison University a few days ago, over the weekend, a young man they think was drinking and passed out in or something, had some kind of medical issue in a parking garage, and they found him the next day passed away. So when you think about things like that, a 21-year-old young person who made the decision, but you think if somebody was with him, maybe things could have turned out differently. So we're going to be testifying on that tomorrow. House Concurrent Resolution 46 really has nothing to do with drugs and alcohol. It's called the ballot arguments. It's already been passed through the House and through the Senate. It doesn't have to have a governor's signature because it's kind of a resolution. Isn't really law. It is more of a kind of a stance on something. It isn't a doctrine or anything. But what this does is it would allow the Speaker of the House and the President of the Senate to appoint two groups to go over arguments for every ballot initiative that would change the Constitution in the state of Ohio. So what would happen is, and I go back to the marijuana ballot initiative, this would allow two groups on the pro side, two groups on the side that does not want the ballot initiative to pass, to actually list out arguments about why this should or should not pass and become part of Ohio's Constitution. So it really is an opportunity, I think, to tell our story as far as all of the science that is behind marijuana, especially on young people, all of the stats about what is going on in other states in regards to marijuana legalization. I really think this is a great opportunity to educate lawmakers, and then they can choose an appropriate position if they choose to on constitutional amendments. Because Mrs. Taft always told me that the legislator's job is tough because they have a knowledge of a subject of subjects that it's a mile wide, but it's only an inch deep. So they have they have to know about so many different things. They can't be an expert at every subject. So getting that knowledge, arming them with education about whatever the subject may be, actually gives them the ability to make better decisions, more informed decisions. So really like House Concurrent Resolution 46, and actually it passed unanimously in both the House and the Senate. So it was also something that was pretty popular among legislators as well. House Bill 144 is the Nicotine Alternatives Bill, which basically would not allow young people to obtain the e-cigarettes. Right now, I guess it's legal for young people to go into a store, buy those e-cigarettes, and be able to vaporize or whatever they want to do. Our concern is not only from the nicotine standpoint, but also marijuana standpoint. There's something called dabbing that is going on in other states where these e-cigarettes are being taken. They're filling them with what's called dabs, which are little kind of pieces. They look like hard candy. It's basically liquefied marijuana that's kind of been hardened. They put them in there, vaporize them, and they can actually smoke marijuana without any kind of odor or anything like that. And there have been reports in other states that they actually do this in schools. You can't smell it. It's kind of a vapor thing, so it isn't like there's a big room of smoke. And so this would outlaw those types of products for kids in the state of Ohio. Also, the opiate bills. There's quite a few opiate bills. Some I see that will pass. The minor prescription bills is now in the Senate. That would allow that would actually prohibit doctors from prescribing opiates to people under the age of 18 unless there's a parent's consent. There was an amendment added that would allow children's services agencies to be notified in case there is suspicion that a parent actually is an opiate addict, and can actually make that call if the parent is suspected of being an addict, and the child still needs opiates. So it's kind of a protection for our kids. That amendment that was added to that bill. Another one that I don't think is going to pass is the pain medication bill, which would basically create some systems that would be, as quite a few medical facilities and medical associations have said, it would be create a burdensome system. What it would do is, if someone is in hospice, there would be a system set up that would that the hospice organizations would have to make sure that all of these medications are tracked even after the person passes, the patient passes away, and there is a point person for each hospice organization. Many organizations, including the Ohio chapter of American College of Emergency Physicians, and all of these other things have come out against it. So I don't think that some of these are going to pass. Some will. So I guess those the House Bill 332 is probably not even going to get out of committee. So we will continue to look at that and monitor that for you. Going to pass it on to Derek to give us an Alcohol Policy Summit update. So Derek, take it away.
Okay, we'll do an audio test. Tony, can you hear me now?
Very tiny.
Evidently, my volume is very low. I will try to turn it up on my end. Otherwise, we'll just switch the headphones and make it easier for everybody. Well, we're very excited for the Alcohol Policy Summit.
We're moving right along with our planning and have a lot of great things that are planned. The summit will take place from April 1st with a pre-conference looking at law enforcement and colleges. We're very excited with both of those tracks and how they're coming together so very nicely now. R.J. Elrick with Pyre will be coming to talk about doing controlled party patrol dispersal. So this would be a great thing for your communities, for your law enforcement, to get them engaged with this. R.J. has been to Ohio previously, and with his training he goes through all the aspects of what party patrols are, then goes to appropriate dispersal of them. So we want to make sure that when law enforcement go to break up a party, that it's something that's taken care of in a safe way for not only the law enforcement but also for the attendees as well. So there will be some action type things that they can do there as well. They'll have a mock party that's set up. So that would be a great thing for law enforcement folks that you're working with. Also, we're going to have Rich Kaloji talk about tracebacks. We have presenters speaking about use of technology and alcohol regulation. We have someone coming to talk about policy to improve compliance checks, looking at event planning on college communities. So we've got a lot of great things lined up for law enforcement. For the college aspect on April 1st, as Tony had mentioned, we'll be talking about amnesty policies and making sure that we get folks medical attention and have that as the primary priority, and think about some of the other issues kind of secondary. Other things include high-risk alcohol use on college campuses, looking at working with the Greek communities and getting them more engaged, working to change some of the community culture related to drinking on college campuses, looking at campus-related social host policies as well as other campus-mandated policies. So there will be a lot of great things for not only colleges and law enforcement. When we're looking at the main bit of the summit, we've got April 2nd and April 3rd. The April 2nd part is making the case. The theme for that is making the case for alcohol policy, and that will include things like alcopops, alcohol's impact on the adolescent brain. We're going to have Aaron White from NIAAA coming in to talk about that. Also looking at alcohol deregulation, changing community norms, community organizing. We're going to have a track on engaging youth. So we've got several different speakers talking about involving youth in policy efforts, as well as the impact of girls and substance abuse and managing special events. Then for April 3rd, we only have 2 breakout sessions for that day because a lot of it's going to be plenary focused. We're going to have focus on alcohol taxes, looking at instituting social host policies, looking at statewide policy change, increasing enforcement of current policies. So if you've got policies, that's fantastic. You don't have to create more policies. You just want to work on enforcing the policies that you do have, and also look at increasing community buy-in and engaging those and empowering those volunteers so they can help spread that message. Because a lot of times volunteers are well-meaning, but not necessarily do they have the skills to really speak the prevention message. So we want to make sure that they are utilized in the appropriate way. And we've got a lot of great plenary presenters lined up. Jermaine Galloway, Dr. Bob Brewer with CDC, Steve Schmidt, and we're very excited that David Jernigan will be here, as well as Vinny DeMarco. He'll be speaking at our Prevention Advocacy Day, and we'll be coming back for the Alcohol Policy Summit as well. So we're just very excited with the way everything is coming together. Registration is open, and you can register at drugfreeactionalliance.org/maps, or you can go to the drugfreeactionalliance.org events page. The cost is extremely reasonable, and we wanted to make sure that it was a good bang for your buck. Everyone's working on limited dollars. So for the April 1st pre-conference, it's only $75, and the 2-day summit for April 2nd and April 3rd is only $150. So this would be a great thing, not only for you, but also for your community partners, even if they're only able to come for one day for the pre-conference. If you're working with law enforcement or your college folks, that would be something that would be a great benefit to them. In addition to the low cost for all this great content, we'll have prevention RCHs available, and we're working with mental health and addiction services, and they're going to be applying for CEUs for social work, counselors, etc. So there'll be a great opportunity to get some really inexpensive hours as well. So if you have questions related to the Alcohol Policy Summit, please feel free to contact me at Drug Free Action Alliance, either via email at dlongmire@drugfreeactionalliance.org, or by giving us a call at 614-540-9985, extension 16. I hope you're very much able to come, as well as your partners that you work with in your community. And again, if you have questions, just let me know. Back over to you, Tony.
Thanks, Derek. I like the way you put it around your neck instead of on your ears, this little thing. So you've inspired me. Just a real quick update on marijuana. We just got a couple minutes left. Was at CADCA last week and was talking to a gentleman from Derek from Washington State. Just wanted to bring this up there. A legislator's been talking to him about how this would work. He is obviously anti-marijuana if he's at CADCA. But there's a bill that they are thinking about dropping in the State House in Washington that would allow school nurses to collect and then disperse marijuana to students in their school system. So it sounds absolutely crazy, but this is what they're thinking about out there. Since it's legalized and since every other medicine has to go through a school nurse, however, at the federal level, does this then make that school nurse basically a dealer by dispersing marijuana? So it's kind of crazy, but that's just one example of how crazy some of this has gotten. Wanted to really quick, the Ohio Rights Group released their finance reports last week. As a PAC or a 501c4, they have to release their donations, how much they have in their bank account, all of that kind of stuff. Last year, the Ohio Rights Group, who's trying to legalize marijuana in Ohio, raised $22,000. What was interesting about that was that the bigger donations, somewhere around $12,000 or $13,000, was actually raised from people out of state. So Nevada and California. The rest of them were smaller donations. $50 here, $20 there. There was $1,000 from a business here in Ohio that somehow extracts marijuana oil from the marijuana plant and then sells it to Colorado. I don't know how exactly that works, but how it's legal. But there is, I think it's called ATEX, ATEKS. But right now they have about $4,400 in their bank account. But they are getting some donations, again, from out of state. Again, my big worry is if they do have some momentum that somebody from the big boys, George Soros or the guy from Microsoft will actually donate, and before you know it, they'll have $1 million in their account. So just wanted to give you that quick update. Wanted to also remind everyone, or hopefully let you know, that today I'm going to do a really quick run through of the Rocky Mountain HIDA report. That will take place at 1 o'clock. It's a webinar. If you want to take part in that, just register at our website. And on a bit of other news, Smart Approaches to Marijuana, the SAM group with Patrick Kennedy and Kevin Sabet that is leading this cause, the marijuana legalization opposition nationally. I was actually named to their national board this past week at CADCA, so that will give us the opportunity to provide you with even more resources from a national level. Hopefully some contacts like former Congressman Kennedy and David Frum and from the Bush administration and some of those folks that we can then use here in Ohio. So it's kind of exciting for Ohio as well. Didn't know if there were any questions or anything that anybody had. Would be more. But thank you so much. Got Greg and Jamie saying go and congrats. So thank you so much for that. But really, it is a boon for Ohio. I'm really proud because it's only because of the work that you guys are doing, the work that we're all in this together. That's the real reason that. Thank you, Eileen. That's the real reason that folks. That's the real reason that that people are looking at us nationally, because we are so organized, because of the work that you do in your communities. I think the proudest moment that I've ever had professionally, and I'm talking going back into even my lobbying days, was hearing people take those messages that we have shared. Thank you, Fran, as well. That we have shared and we have worked together on. To talk to Senator Portman last week at the Hill, and to talk to our congresspersons. We are really, really, really excited that we are in this together, that we're doing such good work, and you know what? We are making I think we're making a difference, and if nothing else, we're making it harder on these folks to get this thing passed. I still think I'm somewhat of an optimistic person. Don't tell my wife that. She probably don't think so. But I still think we can beat this. More and more science is coming out that is showing the devastating effects of marijuana, especially upon our young people. And I think I'm sure we can win this. Sheila had a question, the status of House Bill 392. Actually, it's the very first hearing today. So there was sponsor testimony that was given by Representative Stinziano, but this will be the first hearing. It will be proponent testimony. I think that with as many champions that he has on this, I believe that it will eventually pass. He seems to be, in our conversations with Representative Stinziano, he has been getting an awful lot of praise for this bill, and especially from the college community. So I think it will pass. Again, it's early on. It's in its life. But hopefully, and we may need some of you, if you're interested in testifying on this. We would love to have you be a partner in this. Talk to your local your local representatives. That's what it's going to take. But that's what again, early in the process. But I do think eventually it has a chance of passing. When the webinar is done, can you reshare the first page in the webinar? Miss Getting screenshot, please. Absolutely. I will do that in just a second. Actually, how do you do that? Home? Oh. And then hopefully this is the one. If not, just let me know. Also, a quick question: is there any type of conversation going on about people being drug tested for asking for government assistance? There's actually a bill. Oh my gosh, I know him by his first name, Tim. There's a bill in the Senate right now that actually, and I can get that for you, Catherine. That is just that. That would require drug testing for people who are seeking public assistance. It is not going anywhere. A lot of people are in opposition to that. Everybody from the food pantries and even some of the public assistance groups are against that because they feel that is an infringement on rights. It's a highly debated and hot topic. Tim Schaefer, that's the guy's name, who is the sponsor of it. So Senator Schaefer has introduced it. Again, I can get you the Senate bill number, but it doesn't look to be going anywhere right now. He's brought it up a couple General Assemblies now, and it seems to be such a hot topic that it isn't being taken up for any kind of testimony or vote right now. So I hope that answers your question. Excellent. We have that. I will get that to you. And are there anything else? Any other questions? You guys are the absolute best. At CADCA last week, I keep hearing about how fantastic. We have it here in Ohio. You guys are really doing amazing, amazing work, and couldn't be prouder. From everything that I heard from a national level, we really are the model for the entire nation. So the work that you're doing is valuable. I know that some days it's like beating your head against a wall, but I promise you, you're doing good stuff, and it's being noticed nationally. So just proud to serve alongside of you, and happy to be called, I guess, a working partner, not to offend Dee Mason for her business name. So thank you so much. Any questions, please feel free to email me or give us a call. Thank you so much.